Good morning, and welcome to this special edition of Facebook Live. My name is Maren Turner, and I'm the State Director for AARP Kansas. AARP works every day to try to make sure people have choices as they age. We know, however, that racial disparities in health, wealth, and digital access make it harder and sometimes impossible for people of color to make the needed choices that are necessary as they age. Racial disparities are unfair. Why should someone have access to affordable and quality health care and economic security just based on the color of their skin? AARP is working to disrupt these disparities and make life better for everyone. Here in Kansas, we are focusing on the problems associated with social isolation. Social isolation has a disproportionately negative impact on people of color, due in part to their lifetime exposure to discrimination. We are working with our partners to combat this problem. Those partners include the Kansas Health Institute, the Johnson County Department of Health, and the Wyandotte County of Health. Here in Kansas, we're specifically looking at ways that social isolation can impact people of color, more specifically African Americans and Blacks. And we're also looking at ways to address the problem. Today, we have a panel of experts and representatives from the partner groups we are working with. We're very happy to welcome today Sydney McClendon, who is an analyst with the Kansas Health Institute, Megan Foreman, who is a program manager with the Department of Health and Environment in Johnson County. And from AARP, we have Terry Gingrich, who is a senior research advisor from our national office. Welcome to all of you. Why don't we just go ahead and get started? Sydney, can you just give us a little bit of information on, what is social isolation? Is that the same thing as loneliness? And also just talk a little bit about some of the work that KHI has done with AARP to produce a paper that looks at social isolation in Kansas.
Sure. Thank you so much for having me here today, Maren. So as you mentioned, we released a report with AARP Kansas last January that was really focused on looking at what the literature and the research says about social isolation in older adults. And definitely, I think a good thing to ground us in today is what are we even talking about when we say social isolation? Again, because as you mentioned, Maren, I think it's often used interchangeably with loneliness when in reality, they really are kind of two separate, distinct concepts. So I think maybe the easiest way to differentiate between the two is when we're thinking about social isolation, it is something that's countable. So social isolation is the objective lack of or limited social contact with others. And so those are kind of everyday actual interactions, phone calls, conversations, the actual contacts that you're having with another individual. Versus loneliness, on the other hand, is more of a subjective perception of being alone or feeling lonely. So it's kind of the emotional side of things or an emotion that you experience. And while those are obviously very connected and intertwined concepts, they are different and impact the types of policies and interventions that we may be thinking about, right? I know, Maren, you mentioned a lot of the great work that's happening with some of the other partners on here. And I think a key thing to keep in mind are the differences between the two when you're thinking about what do we want to do to impact it. I think another thing that I would mention just quickly now, so we mentioned the report that we released last year. A couple of things to what you had mentioned on the outset, Maren, that we were looking at are what are some of the risk factors for social isolation? What may increase somebody's risk of being isolated? You mentioned, some of those demographic factors, so race, ethnicity, but also we were looking at things like LGBTQ status, immigration status, English proficiency, all of which we saw in the literature can potentially increase someone's risk of becoming socially isolated, which is something that we all need to be paying attention to, as we know that social isolation is linked to things like mortality, increased health risks, dementia, and also just poor mental health and substance use. So that's a little bit of a snapshot of what's in the report, and happy to unpack that as we go today.
Yes, that report is available not only on your website, but AARP is making that available as well. So if you're just now joining us, my name is Maren Turner, and I'm the State Director of AARP Kansas. And today we're talking about ways to disrupt disparities around healthcare, specifically healthcare as it is impacted by social isolation. We know, again, that social isolation can impact the health of anybody negatively, but there's a disproportionate impact on people of color due in part because of a lifetime of exposure to discrimination. So Megan, can you talk to us a little bit about what that really looks like? You know, how does social isolation impact your health? And what are you seeing in Johnson County and just in Kansas?
Sure. So, the typical public health issues, people don't really think about social isolation being one of them. But we partnered with AARP and KHI, pre-pandemic, so it feels like a long time ago, to look at this issue and to explore it with our community partners, because it's really going to take all of us, I think, to address it in a way that is impactful. We know that social isolation is as damaging to health as smoking or as abusing alcohol over the lifetime. So, as you pointed out, it's really a lifetime of effect can kind of build up and really impact physical health as well as mental health. So we know that nationally, 1 in 4 people describe having this problem of social isolation. In Johnson County, we have 12% of our population that says that they have inadequate emotional or social support. And I can't speak for Wyandotte County, but I imagine that they have similar findings in their community health assessment work that they've done over the years, which is really why we kind of wanted to partner together. And I think, as we talk about potential solutions, one of the things to keep in mind is that these connections that people make with each other, they don't have to be long or in depth or even take a lot of time, but they do need to be authentic and meaningful. And so when we talk about the types of different communities that may need additional support here, we really want to make sure that we're meeting them where they're at and that they have access to connections that are meaningful and authentic for them.
I think you made a really good point, because this is not about, say, having 1,000 friends on Facebook. This is about having people in your life. It could be 2, it could be 3 people, but these are people that you have a very strong connection to. People that you can pick up the phone and say, I need something, or people that are going to check on you, people that really genuinely care about you.
That's exactly right, Maren. One of the pieces that I think was interesting in the research that we did, this sort of national statistic that I throw out that 1 in 4 people are socially isolated. What the question actually is do you have a person in your life that you could talk to about a personal problem? And I think it's really remarkable and sad, but frankly, something that every individual has an opportunity to help contribute to improving. When you think that somebody doesn't have even one person in their life that they can call and talk to about something. So I think there's a place for every individual in the world, right? To just be that person for one other person in the world.
Sure. And have you seen any differences in, say, the impact of social isolation pre-COVID-19 versus during COVID-19?
Yeah, I mean, that's a huge question, right? And I think we haven't even had time to really unpack what has gone on. But I will say that I think that people appreciate more what we're really talking about when we say social isolation. I think in the past, maybe certain groups or people who are very busy in the world wouldn't have understood the impact that can have on an individual. But I think we've all probably lived through more isolation than maybe we would have chosen to live through otherwise. And, one interesting note when we think about the mental health consequences of social isolation in Johnson County, and again, I'm being very local with this data, this is not necessarily the picture nationally, but we have seen our suicide rate come down during the pandemic, but the increase has been what we've really seen an increase in, let me say, is the use of things like the suicide prevention hotline. And we've really seen people reaching out and saying, I'm not okay, I need help, I need somebody to talk to, which is wonderful, right? I think we've seen now those prevention resources that are in place, people are really taking advantage of them. And our hypothesis is that it's having an effect then on the suicide rate. So these services existed before, they will continue to exist after, and I hope that we've all learned that they're there and that we can take advantage of them in a successful way.
Well, having the suicide rate, come down is definitely not that there's anything good about a pandemic, but certainly it's great to hear that, particularly in Kansas. So that's really good news. I want to remind people in our audience, if you have a question that you'd like to ask Sydney or Megan or Terry, please just write it in the chat box and we'll get to your question. So as I said at the beginning, we're looking at some of the disproportionate ways social isolation can impact people of color. And after working with KHI to do the literature review, AARP dug a little bit more deeply to do more one-on-one research to find out how this pandemic and how social isolation is impacting African Americans as versus, say, non-Hispanic whites. And so to that end, we conducted our own research using focus groups. Terry, can you talk a little bit about what the findings were from that research?
Sure. Good morning, everybody. It's a pleasure to be here. Before I delve in, let me just give you a quick description of what we did. We conducted 2 online focus groups on June 25th of last year. One was with white Kansas residents age 40 and over, and one was with African American Black Kansas residents 40 and over. In addition to this, starting in June 29th and continuing through July 5th, we journaled, we used a journal approach with Kansas residents 40 and over, and asked them to share their thoughts and experiences of social isolation over 3 days through a series of multi-layered questions that we asked them each night. And our purpose was really to hear the perceptions and experiences of social isolation among residents in Kansas, and to learn of any disparities that exist, particularly between white people and people of color in Kansas. And just to briefly set the stage for what this time looked like in Kansas, even though we probably don't want to go back and remember, but in June 25th, there were nearly 13,000 COVID cases in Kansas, and there were 261 deaths. And on June 29th, when we started our journaling, the governor had just issued a mask order in the state. So I just want to go through our top 5 findings. So the first finding, most important, we did find disparities abound in social isolation in Kansas. It was widely experienced, and there were significant disparities about among who it impacts and the burden that it bears for people. Seniors by far were viewed as the most affected people by social isolation, as were people that had health, emotional, or mental illnesses, people who are single, nursing home residents, and then also prisoners came up as a population that's isolated. And there was evidence to support social isolation was universal. One of our respondents said this: I think everyone experiences loneliness and isolation at some point in their life. So, there were a lot of disparities, and there were a lot of experiences of social isolation. Our second finding is that even outside of COVID, we found that many people of color expressed feelings of isolation, and many expressed them in a way of being the only one of none. And I just want to read a few comments of, these really heartfelt comments that people of color wrote about this experience. Here's the first one. I was kind of isolated because I didn't see anyone else like me. Another one, being the only one is very exhausting. And a third one, it can be very isolating to be in a place where you don't see people who look like you. So even in this pandemic where there is universal social isolation, there's a special, a certain population that's feeling it all the time, regardless of the pandemic or not. So the third finding I'd like to share is that it seems like now more than ever, there is a desire to address social isolation. It's not seen as a new phenomenon, but COVID has appeared to exacerbate its prevalence. And it may make this issue one of today's most pressing priorities and a relevant challenge to solve. And the fourth finding I'd like to share is that people did realize a relationship between social isolation and mental health, emotional health, but not so much about it affecting their physical health. It was viewed that social isolation can negatively affect mental health, but less of a relationship between the actual physical health that social isolation can cause. Our last finding I'd like to share is that when it comes to overcoming social isolation, freedom and control appear critical. And like Megan had said, it's not so much the quantity of social isolation, but the quality of the interaction that's experienced. We didn't find any ideal kind of social network or ideal social life among our respondents, but we did find that having a choice, having control over when and who they engage with is key. And the desire is really for a fulfilling social interaction with someone, and not a large quantity of them, but a few meaningful relationships. And I will turn it back to Maren and thank you for this opportunity to present our results.
Hello. Okay, I think we had an interruption there. All right, so thank you, Terry, for giving us that information on the research done with the focus groups. I had the opportunity to sit in on those focus groups and found, as you said, the differences between the two very stark. One of the things that I found very interesting was, some of the respondents talked about the fact that, seeing people with masks on made them feel isolated because they could no longer read expressions. They could no longer, enjoy some of the body language that goes with talking to somebody in your community if you can't see their mouths. And so, I thought that was particularly interesting. Okay, so as we talk about social isolation in Kansas, AARP is definitely focused on not only figuring out what the problem is and how it unfolds in Kansas, but we're also looking at coming up with some solutions so that we can combat this issue. Sydney, based on the research that KHI has done, do you have any recommendations on what we would need to do to move forward?
Sure. I think one thing really building on what Terry was talking about there at the end, thinking about this idea of control and having it be somewhat driven by the individual. One of the things that we saw in the research is that when you're thinking about interventions, ways to address social isolation, some of the things that make those interventions really successful is when you take into consideration the local context. So what you may be wanting to address, like if an issue that's preventing folks from connecting with others is maybe there's a lack of transportation, and so you can't get to where other people are, then that may be how you want to address social isolation, but transportation may not be an issue everywhere. So the local context really matters, and also including the folks who are going to be impacted when you're thinking about designing those interventions is also really important. So you can kind of have the end user be part of the design and implementation. That's one way that things can be really successful. And I think one other really critical element for this too is we need to know who is socially isolated, like where the issue is in order to address it. And so one thing that I think we're seeing more movement toward, and I think it could be really positive, is additional screening for social isolation, potentially within our health systems or other places that folks are commonly going. So we can really identify those individuals who are maybe most at risk or who are experiencing social isolation, and then ideally be connecting them with resources to help mitigate it. I know we ask a lot of our health systems already, but I do think that's one critical area where really almost everyone is going to interact with the health system at some point. So just another step in trying to identify who could use resources.
That's a very important point that you made, working with healthcare resources. And perhaps part of the screening could be during a visit is to ask a person if they are socially isolated, or however you want to word that, so that you can find out, as you said, who is isolated and how is this impacting their health. And so I think that's a very important point you made there, and something that we can all work on. From the Department of Health's perspective, Megan, what are some recommendations that you have in terms of how we combat this problem of social isolation here in Kansas?
Absolutely. And I love that Sydney started with kind of that very individual level. And then I can actually give you kind of the 30,000 foot view. There are community design opportunities that cities and counties have to really make the built environment conducive to people, gathering in places and having a space to sort of interact with each other. One of the ways that we can do that is to encourage our cities and counties to become communities for all ages. And that speaks a little bit to kind of that local feeling that you have, but it means that spaces are universally designed so that people with disabilities or perhaps transportation issues, any of those other barriers that we see to gathering, it makes it accessible for them. I think we also think about collective spaces that are just sort of shared in a community garden, or, a big lawn area where people can just sort of, I see it all the time now with COVID in the neighborhood where I walk. There's a big park. And people bring their lawn chairs out and they sit, apart, and they gather there because it's a safe place to visit. So I think making sure that our communities are designed in that way. And then I kind of want to bring it back to the disparities that launched this conversation in the first place. When we look at the community disinvestment that communities of color have seen over time, we can very clearly see how a lot of those communities don't have the same sort of amenities that some of the other ones do. And so I think that that's another way we can work to sort of address building resiliency in communities, is also making sure that the built environment supports that resiliency, and that, we're taking down literal physical barriers to people gathering.
I'm really glad that you brought up this whole issue around the built environment. That's one of the areas that AARP is focusing on here in Kansas. So, for example, we were able to work with the city of Wichita to install a grandparents park. And one of the reasons for that, even though it's called a grandparents park, anybody can go, but one of the reasons for that was because people in the neighborhood said that they wanted to have some place they could gather and take their grandkids and just have a sandwich and just, talk to other people. We've done something similar in Topeka. We installed a fit lot, and people are saying the same things. I also want to make sure that our audience knows that AARP has what we call a challenge grant. These are micro grants for organizations that want to make a difference in their community. And what we found here in Kansas is that there have been a lot of groups that have taken that challenge grant and done something to increase interaction with neighbors. So, for example, in Southeast Kansas, there was a group that took the challenge grant money and increased the livability and the walkability of a path in a very at some point it was a very depressed area, and people weren't getting out and walking and getting to know their neighbors. And so they took that money and made that walk a little bit more livable and a little bit more enjoyable, so people would come out. They also did things that helped people to work on their porches, so that they would sit outside and they would see other people and their neighbors could see them. So they did some improvements in that area. So I'm really glad to hear you talk about how important the built environment is in terms of supporting interactions and helping people feel less socially isolated. So Terry, and from a research perspective, and based on some of the findings that AARP discovered from these focus groups, what would be your recommendations on ways to combat social isolation in Kansas?
When we journaled, through our journaling research, people seem to identify different stages of when they were more isolated throughout their lives, that they were looking through their lives. We're interviewing people 40 plus. And, when people move into a new area, when kids go off to college, when people retire, it seems to be that some of these events can spark isolation, and there could be some intervention sort of along this life path of life. When someone gets sick, a caregiver, when somebody, there are some natural, I think, interventions that we can do for social isolation. I think people did recommend a lot of problems with transportation, lack of money, resources to go places, physically get out and do things. I think those are some of the barriers also that were identified. Something as simply as a buddy system, like the Big Brothers Big Sisters was identified, and you have that for the youth, maybe have that for the elderly, anything to bring multi-generational people together, and to benefit that.
I think the buddy system sounds really great. I'm also glad to hear you bring up the whole issue of caregiving. If you aren't a caregiver right now, you may indeed be one at some point in your life. And although caregivers quite often step up to the plate because they want to take care of their parent, or they want to take care of someone they really care about. But if you are working and trying to take care of your children, trying to take care of your parents, it can be very exhausting. And before you know it, you're saying to your friends, I'm sorry, I know we used to meet for lunch, but I don't have time. Or you're not going out and you're not taking care of yourself. You're finding that you're too tired perhaps to go to church or some of the things that you used to do. And before you know it, you're isolated. So I do want to make sure that our viewers understand that AARP has a wealth of resources to support caregivers. We understand some of the challenges that are faced, and I invite you to log on to our website, www.aarp.org, to link into some of those resources so that you don't become socially isolated. Okay, so we have a question in the chat box. It says, I work with individuals who are blind and have visual impairments. Did any of your research address that population? I know that isn't the focus of this talk. If this derails the conversation too much, then don't disregard. But did any of you all address people who are blind or have those that type of an impairment?
I can maybe jump off with that, and then Terry, I don't know if you have anything else maybe to add from the focus groups too. I know, so one of the risk factors that we saw for folks who may have a greater likelihood of becoming socially isolated was things like potentially poor health or well-being or other impairments that folks may be experiencing. So we definitely saw both visual impairments, but also hearing impairments can potentially increase the risk of becoming socially isolated. I think, again, there's a lot of variety in terms of different interventions and policy solutions that folks have tried to implement to address that. And I think, taking into consideration, again, the direct context and the individuals and what the impairment may be is an important thing in designing potentially ways to counteract that. I know one thing we saw, this isn't necessarily visual impairments, but for hearing loss, that actually giving folks hearing aids could increase the quality and quantity of social interactions for folks as just one kind of solution to address that particular impairment.
And I would just add, we didn't really make sure that we talked to those populations in our research, but they were always identified as the potential to be the most isolated and the most barriers to engagement, and kind of the people that we definitely need to make sure that there are solutions for.
Yeah, and Maren, if I could just give a quick plug to some of the work that AARP has done around these caregiver policies that you mentioned. In Johnson County, we actually looked at some of that research, and it helped drive the concept that we passed a couple of years ago called caregiver leave. So we talk about parental leave for new parents or things like that, but we really saw a gap for kind of an aging workforce full of a lot of women of a certain age who probably have caregiving responsibilities on either end, maybe parents and children that you talked about. But we actually now have paid time off for people to be able to care for family members, to, you know, if you're needing to move someone into an assisted living facility, something like that, really making sure that we're sort of taking care of that other end of life as well as having a new baby. But I think that there's a lot of ways that people who maybe aren't even yet in that senior population can advocate to make sure that we have more just space to breathe as people and to be in those caregiving roles and to connect with others.
Good point. Good point. We have another question. Did your research include individuals residing in nursing homes and adult care homes?
We didn't. I don't know. It could have. I doubt it. We didn't really screen for that. So, you know, this was very qualitative. We talked to about maybe 75 people in total. So, yeah, I really don't know for sure. Outside of just the need being recognized for people in nursing homes and adult homes, and you know, the need to have that intergenerational contact there were a lot of solutions on that end.
So we don't know for sure whether or not people lived in nursing homes or adult care homes, but I can tell you we worked with the area agencies on aging in both of those in Johnson County as well as in Wyandotte County to help us identify people who may be socially isolated. And we made sure we put all kinds of supports in place. So let's say if someone did not, say they lived in a nursing home or they lived in a adult care home and they didn't have the resources there, we were able to help provide some resources, say, you know, either through the public library or some other means so that people could participate in this research. But we don't know for sure whether they came from a long-term care environment. Okay, so we still have time for one more question. If you have one, please type it in the chat. I also want to bring to your attention that scrolling at the bottom of your screen, you'll see contact information for the Kansas Health Institute, for the Johnson County Department of Health, and also the Wyandotte County of Health. So if you want to follow up and find out more information on resources available for people who are socially isolated or who are at risk for becoming socially isolated, I invite you to take advantage of those resources. So with that, I want to wrap up our conversation today and just ask each of you if you have any last comments about this topic, and particularly if you have a specific resource that you'd like for the audience to know, so that they can tap into that resource. So we'll start with Terry and AARP.
Thank you. You know, when we first started this research, we had a great plan to go in with live focus groups throughout the entire state of Kansas, and you know, really delve into these topics. And you know, when COVID hit, we had to pivot. But I think it was a great pivot because I don't think our learnings would have been as rich or isolation felt as universally as we discovered without doing it through this pandemic. So, you know, I think that was just, you know, this opportunity to do this was so rich, and we have so many learnings from it. So we'll be continuing to get those out as time goes on as well.
Great. Sydney?
Sure. I think kind of going back to something that Megan had mentioned a little bit earlier, and Maren, you as well, obviously I think social isolation feels very real for a lot of people now, you know, having lived through a pandemic for a year and a half at this point almost. And I think one thing that I hope we are still continuing to keep at the forefront of our mind as we're thinking about this is, even though it's impacted everyone, it does impact certain folks more than others. And particularly, again, coming back to why kind of the impetus for the conversation today, and impacts on communities of color as well as other folks, that when we're thinking about solutions, that we are really thinking about who is disproportionately impacted. So it's definitely one thing to keep in mind. And in terms of resources, I think one thing that's also sprung up during the pandemic are mutual aid networks throughout the state. And so thinking about that as a potential resource to tap into. I think a lot of those are on Facebook that you can find in your local communities. And there are also other ways to identify them online, but that may be a resource for folks as well.
Okay, very good. And Megan?
Sure. So I think, you know, I love that you mentioned the mini grant opportunity that exists. And I think to kind of piggyback on what Sydney was talking about with those local solutions, I would call your attention to the My Sidewalk Dashboard link from Johnson County that's in the comments section. That's where we have a little bit more information about the research that we did in Johnson County, and then sort of our hopes for improvement moving forward. But I would encourage you to, if you're in Johnson County or in one of the other counties in Kansas, reach out to the health department to see if they can help you with any of these mini grants or just give you resources to kind of start you on your way. If you have a solution or idea for how this can be improved in your community. Some of the basic work that the health department does is a community health assessment and improvement plan. So we really do try and look at kind of what is not working well in our community and think about how we use partnerships to improve that. So reach out to your health department because most of them are interested in this topic right now.
Absolutely. You know, again, as you mentioned, the mini grant, I want everyone to know that the review period for this year has closed. However, it is open every year. And so if your organization has an idea on how you can bring people together and how you can improve or combat this whole issue around social isolation, I encourage you to apply. You know, the money could be anything from $100, a couple $100 to, you know, a few $1,000s if you think you can make a difference. Also, you know, as Sydney was mentioning earlier today, from an AARP perspective, we are going to look into, you know, do we need to work together to institute a policy so that when you go to your doctor's office or when you go to see your healthcare provider, they do a screening to find out if you're socially isolated and how this might be impacting your health. That's really important. And then AARP Kansas provides a variety of resources and supports to people. Sometimes it's in the form of entertainment, you know, where we bring people together, like with our movies for grown-ups. Right now we're doing it online, but you know, after, you know, things settle down a bit, you know, we'll get back to bringing people together. And we found from our research that people enjoy activities like that. They can go to a movie, sit beside people, you know, other people. They don't have to interact if they don't want to. But one of the learnings that I heard from people in the focus groups was, you know, sometimes they're not even interested in that particular activity. It's just the idea of being around other people and connecting with other people. And so AARP Kansas will continue to do that. We'll continue to work on the built environment and just a variety of things. So I encourage you to check our website out every single day because there's something different going on. Again, this has been a really great conversation. I want to thank everyone who joined us in the audience for your questions. And know that this work is going to continue. You can contact any one of us if you have questions or suggestions on what can be done about social isolation. Thank you to all of our guests and thank you to our partners. And we look forward to talking about this and doing something about it in the future. With that, I will say this ends our broadcast today. Have a good day for the rest of the day. And be